Overdose deaths in Canada have skyrocketed since fentanyl has entered the market last year.
The number of illicit drug deaths in this province is truly a crisis.
The federal government should declare a federal public health emergency.
There's no perfect solution to fixing this crisis, but here are some big ideas. What if we cut off the supply chain? According to border officials, China is the main source of fentanyl coming into Canada. Fentanyl is so potent, suppliers can send it in small envelopes, but border officials can only open packages that weigh more than 30 grams. China and Canada have agreed to coordinate policing, but the effectiveness of that is still being debated. A bill is also sitting in Parliament that would allow border officials to open packages they find suspicious that weigh less than 30 grams. What if we decriminalize drugs? Portugal decriminalized all illegal drugs in 2001. Today, it has one of the lowest fatal overdose rates in the world. But they say it's not enough to just remove punishment. You also need support systems for treatment, which takes us to just that. Suboxone is a form of opioid replacement therapy that stops withdrawal symptoms and heroin cravings. In France, wider access to it has led to a nearly 80% reduction in overdose-related deaths. Despite its effectiveness, a small percentage of doctors in BC prescribe the drug or even know how to. That's because the drug is complex. It can only be taken during a specific stage of withdrawal, otherwise it can cause severe side effects. And what about more radical forms of treatment? A Vancouver-based study showed injectable diacetyl morphine is effective for those who continue to use illicit heroin, despite attempts with methadone therapy. At the Crosstown Clinic, physicians say more than 350 people have been screened and are ready for treatment. But the idea of giving addicts free drugs to inject into their veins is one that gives some people pause. Finally, what if we looked at the root causes of addiction to stop the fentanyl crisis? While addiction is driven by a complex mix of social and genetic factors that science continues to unravel, trauma is turning out to be one of the main predictors. But in BC today, services aimed at the root of addiction are declining. And it's not just beds. BC needs more trained specialists.